We're joined now by HHS Deputy Secretary, former HHS Deputy Secretary, Alex Azar. Alex, we now hear that Senator McCain will be out probably for more than 1 week. So a vote on the bill will be more than 1 week hence. That looks to me like pretty bad news for healthcare reform. Or what say you?
Well, I think, as Karl Rove said earlier on the show, it depends how you use that time. If you take this window and allow the Democrats to keep creating a narrative of taking insurance away from people, increasing cost, et cetera, then that's a bad thing. If instead you use this time and the president, the vice president, the leadership are educating senators and congressmen about the good elements of this program and what it's going to do that certainly is better than where we are under Obamacare now, and if you educate the people about this and bring them along, then that's a good use of time. But, you know, folks have to be out there talking about this to the point that they almost want to throw up. They're so tired of explaining all of the good things in the change. And unfortunately, that's not really happening right now.
But in the next couple of days, I think maybe tomorrow, there'll be the latest CBO scoring of the latest bill. And inevitably, that is going to come up and say X million people will be dropped from coverage. Inevitably, it is going to be a negative. That's not helpful.
That's right. No, that's right, Stuart. Every time I don't know why everyone keeps thinking that when CBO comes out with a new score, somehow it's going to be some miraculous thing here. CBO is notoriously bad at predicting dynamics of the insurance market. They have never gotten it right. They do a fine job as normal economists. But when United Healthcare, Aetna, Anthem, when they can't even predict their risk pool, their enrollment levels for the coming year in Obamacare, how the devil do we think that a bunch of health economists in Washington, in the government, are going to do a better job than them predicting 10 years out?
They never got it right in the first place, as I recall. They're always wrong. Wrong way. CBO.
Miles off. Miles off, and that's where Republican leadership ought to be creating a narrative now, explaining the good things they're trying to do in this bill.
The trouble is, you've got to fight the media. The media will instantly say X million people off it. It's a terrible thing. I mean, it's guaranteed. The other side of the coin is Senator Rand Paul, vocal opponent of the bill. He says this bill, before the Senate, would create a super fund to bail out insurance companies. Is that accurate?
I don't think it's accurate at all, although I think Rand Paul's concerns certainly ought to be listened to. He's a good clarion voice on the right to help keep the debate honest here. But frankly, these payments to insurance companies in the states are what you and I have talked about before: risk adjustment, reinsurance, risk corridors that help an efficient insurance marketplace function in that unpredictable world of not knowing who's going to enroll in your plan. Now listen, these can be implemented in a way that end up being subsidies to insurance companies and having counterproductive impacts. They can also be implemented in ways that lead to lower cost insurance, stable risk pools, and a very healthy insurance market. Especially with the Cruz amendment that currently seems to be in the package, because what that's going to do, I think, is pull a lot of your young, healthy people out of the exchange markets into this unregulated marketplace, and it's going to leave more of your older and less healthy people in the exchanges. And what Senator Cruz has said is, let's put $70 billion into that as support, because there sort of is a governmental obligation to help people who can't afford insurance, who are unhealthy, but let's not do that on the backs of the young and healthy, which is what Obamacare does. Let's do that as taxpayers.
Would you vote for this bill as it's now currently presented to the Senate? Would you vote for it if you were a senator? Would you vote?
Well, Stuart, I think you and I generally agree that the status quo is pretty bad, and any change to that that's productive is a good thing. I would still like to see more changes. I was very disappointed to see the removal of the reduction in personal income taxes that are in here, that are killing growth.
If we cut right through to it, though, I'm sorry to interrupt you, Alex, but look here, you cut right through to it. I keep saying that something, no matter what it is, something is better than nothing. Where do you stand on that?
It's very dangerous to let the perfect be the enemy of the good, especially when you have to get 50 people in the U.S. Senate to agree to it.
You're a diplomat. Alex Azar, thank you as always for joining us. You know what you're talking about, and we appreciate that. Thanks, Alex.